Kidney Care Connection, a new center built to advance our mission to make life better for those living with kidney disease. A place where people newly diagnosed with kidney disease requiring dialysis will find the intensive support and guidance they need to adapt to this change in life and understand their treatment options. A community where they will be empowered to take control of their care going forward and live life as they hope to.
Compassion is really putting yourself in the shoes of another person and trying to understand the challenges that they're facing and the ways that they have to adjust to what might be a completely new reality for them.
Compassion, it's in our DNA, and we demonstrate it from the first moment we meet every new patient.
What I usually see when we start talking about dialysis to a patient is that it's a terrifying idea.
The biggest thing is worry and anxiety.
Some of them are in shock. Many of them are in denial.
They don't know what's going to happen to them. They don't know if they're going to die.
It's with these feelings, these strong emotions, that many of our patients enter our clinics for the very first time.
They may see someone next to them get sick with low blood pressure or high blood pressure, someone screaming with pain, and that's not going to help their anxiety in any way.
With compassion for our patients in mind, our team has been working for many years on how to change the current way of introducing patients to kidney care. It's not surprising considering our history of innovation. Satellite, under the direction of our founder, Norm Copeland, was among the first to move dialysis out of the hospital and into a freestanding clinic. That was in 1974.
We followed it up in 2003 with the first well-bound training centers and dedicated to home dialysis. And so we've always listened to what patients really need. And we've listened very carefully. And so we're really excited and proud of opening in 2022 the first Kidney Care Connection.
Kidney Care Connection. It's a community. It's a new way for patients to start dialysis. Instead of you being in a center where the standard is in-center hemodialysis, now you're actually going to be in a separate center where the standard is you're involved in the treatment and everybody around you is a new patient learning about this.
Provide an experience for people that is incredibly personalized, geared towards both stabilizing them emotionally as well as clinically.
Enabling them and empowering them to really cope and live the best life possible. We're beyond dialysis. It's about caring and nurturing a patient.
I do view it as a temporary home for these patients, allowing them a soft landing as they transition to dialysis. And we will try to empower them to understand what it means to have the diagnosis, to make the best choice for them and how to manage their dialysis moving forward.
We're doing that in a center where everybody is a new patient. And we're using machines that are mainly for home dialysis. And we're involving them in their care. So we're building their engagement in the care.
Having patients that are all new, that are all going through this together, they will be encouraging one another, patting each other on the back.
One of the important aspects of the new Kidney Care Connection model is peer-to-peer or patient-to-patient communication, not just between other new patients that are also in the program, but between the new patients and other patients who are further along in their kidney care journey.
When someone is starting new, hearing someone else's journey probably is a way better story than anything I can tell them.
Making a connection with other people who are going through it is so much better. The pain gets divided when it's shared.
Lots of resources, expertise.
There would definitely be more home patients. There's no question about that.
Kidney Care Connection, disrupting the way patients begin dialysis
Kidney Care Connection really brings a lot of benefits to physicians. Telehealth will be available at the new center to make rounding much, much easier. And the extra levels of support that are there at the center should make that rounding process very straightforward and easy for the nephrologist. But I think the real benefit for the physician is understanding how worthwhile it is for the patients to get that extra support in the beginning, and to know that the physicians as well will be supported in extra ways as they adapt to their patients being in this setting and transitioning to dialysis.
Physicians have a lot of influence, and rightfully so, on their patients. We'll rely on you to really make this happen. I'm very confident because we built it not because we thought this was the way to do. We built it based on your prescription, what physicians need for their patients, what patients want for themselves.